Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, what's going on?
Not much. How about you?
I am so happy to be here as always. And today's topic is one that I think a lot of people are going to be excited about.
Yeah.
And I'm just going to say it's Jatenzo.
Correct.
Is
Jatenzo.
it Italian?
Not a clue. I didn't come up with the name.
Jatenzo. Am I right? Jatenzo?
Jatenzo.
Jatenzo. All right, here we go.
Yeah.
Let's do it.
So Jatenzo is a newer medication on the market, so I wanted to come in and talk about it. It is a testosterone undecanate.
Okay.
So it's a type of testosterone that is supplied as a oral capsule administration.
Okay, so it's a type of testosterone that is prescribed, and we're taking it like a pill.
As a pill.
Cool.
Yeah.
Okay.
So it's a new technology. Hit the market in February of 2020, but it's starting to gain some more momentum now. Starting to use it some throughout our offices. So typically, we would not recommend oral administration of most hormones. Estrogen, testosterone, it tends to hit the liver, has effect in the hepatic administration and all that. So not something that we typically would go for. But Jatenzo is different. So when this is taken orally, it combines with the lipoproteins that are in the gut, and those particles are absorbed through the intestines into the lymphatic system. So we are completely bypassing the first pass effect, completely bypassing the liver. We are going straight from the gut out into the lymphatic system, and that's carrying it straight out into the bloodstream.
And going through the liver is kind of the downside of taking anything through a pill form.
Correct.
Okay.
Yeah, we don't want to have any negative effects on our liver. So that's where Jatenzo is different. Intestinal lymphatic system is absorbing it. It's never getting to the liver.
Okay.
Yeah, so it's super cool technology that they've used with this. So like I said, supplies it directly into the bloodstream. We're bypassing the liver. This would be a great option for patients who have low testosterone. So we need some sort of replacement, but they're maybe squeamish about getting pellets, not really interested in doing the weekly injections. Creams are not the best as far as absorption and all of that. So this would be another option for someone who wants to stay away from needles, basically.
It does sound pretty simple. Like it's similar to taking a vitamin every day.
Yep, absolutely.
Okay.
So the hardest part with this is that it's twice daily dosing.
Okay. So you do have
So you've got to keep up with that portion of it. So you've got to be very consistent with this. But it's an option if somebody doesn't want to be doing the needle side of things.
Yep.
So typically it started at 237 milligrams taken orally twice daily. So like 8 a.m., 8 p.m. sort of thing. We want about 12 hours in between doses because that's when those levels really start to drop off.
So once in the morning, once in the evening.
Yep.
Okay.
Yep. Then we check levels, and if we need to adjust the dose up or adjust the dose down, we can.
Okay.
Labs should typically be drawn about 6 hours after you've taken your morning dose. That gets us our most reliable labs on this. And then again, we make dose adjustments based on what we're seeing in those labs.
Is there any, I know you guys talk a little bit about taking a holiday. Is there a holiday involved in this, or you're like, boom?
No, not necessarily needed. Just
Okay.
take your medicine every day.
Okay.
So prior to starting Jatenzo, we have to confirm low testosterone levels. This is a medication that we definitely want insurance to cover because it's going to be really expensive if it's not covered by insurance.
Okay.
So that can be kind of the one downside to this is actually getting insurance coverage with it. So the process for that, we have to have at least 2 morning draws for testosterone drawn prior to 10 a.m. and both of those need to register as low.
On the normal scale.
On the normal scale.
Okay.
So, we use more of an optimal scale. Right. Typically, for insurance purposes, you're going to have 2 levels less than, I think it's usually 250 is on the normal scale.
Interesting.
Otherwise, if you come in with levels of 300 or 400, that's something that we would start therapy on, but insurance is probably going to say it's not necessary and probably not going to cover this medication.
Okay.
Yeah, so that's the one complication we get into with this.
Okay.
Side effect profile is similar, like the risks are very similar to any other administration of testosterone. So the risk for increasing estrogen levels, increasing PSA levels, increased blood pressure, increased blood thickness, so your hemoglobin and hematocrit. But studies have shown that even though hematocrit did increase in most patients, it's still, in 97% of patients, it still stayed within range. So we're not getting these big jumps in blood thickness like what we can get with the injectable testosterone.
Okay.
Much, much, much less common with the oral administration with Jatenzo.
Interesting.
Yeah.
So would that be like a type of person you put this on if they're prone to having thicker blood? Okay.
Yeah, absolutely. That could be a big benefit. Some patients, you know, they just jump as soon as you start them on injections or pellets, and they're chronically having to donate blood, and it can become an issue.
Yeah.
So like I said, 97% of patients on Jatenzo did not go outside of the normal range.
Interesting. Super
Yeah.
cool.
So we still monitor labs every 3 months, still periodically monitoring blood pressure, all the same monitoring that we would do for regular testosterone.
Okay. And this is like considered hormone therapy.
Yeah.
Super
It's just another way to do it.
Another way to do it. I love these different options. I think that's one thing that people don't understand with hormone therapies. There are so many different ways to do this, and this is another wonderful way to do it.
Yep, absolutely. So it's a great option to check into.
Yep.
We use a specialty pharmacy to prescribe this to, just because the chances of getting the PA, the prior authorizations done well, and getting the medication covered and getting the coupons applied and all that. If you use a pharmacy that really knows that medicine, they're going to be able to do that better for you.
Super cool.
Yeah.
Jatenzo.
Jatenzo. I love it.
Robin, you have explained Jatenzo. Thank you so much.
Absolutely.
Guys, y'all name it, we explain it. As always, we'll be back next time.
Don't go away.